Hello everyone, my name is Fernando Acosta. I'm an industrial engineering student from the University of Puerto Rico at Mayagüez. And this summer I'm working with Professor David Sontag and Sishan Hussein from the Clinical Machine Learning Group. My project is called a data-driven decision support tool for treatment selection in multiple myeloma. Multiple myeloma is the second most common hematological malignancy. And although there are many treatment agents available, there seems to be a lack of data-driven treatment selection process. To tackle this problem, a web-based data-driven decision support tool is being developed. Our goal is to have better outcomes and less adverse events. Previous work in this area can be categorized in two main aspects. We have the modeling part and we have the qualitative studies part. In the modeling part, researchers are interested on developing predictive models that can help doctors take decisions with respect to treatment selection. For example, an ex vivo platform for the prediction of clinical response in multiple myeloma is a model that is capable of predicting if a patient will respond to a specific type of treatment. Qualitative studies, on the other hand, are more interested on understanding what are those factors that physicians and doctors value at the time of treatment. Our aim is to combine the qualitative aspects with the modeling efforts to develop a well-rounded decision support tool. To do this, we're using the COMPASS dataset. COMPASS is an observational study that contains around 1,150 patients that were followed up every 6 months for a period of 9 years. Age ranges vary from 27 to 93 years old with an average of 64. And we have longitudinal data like lab values across time. We also have different treatment regimens that patients were exposed to, complications, and biodata. With respect to the tool, we are using the COMPASS dataset to develop an initial prototype. And this summer, we'll build a web-based prototype that showcases 3 pieces of information. We're showing survivor curves as a function of different treatment using a Kaplan-Meier estimator. And we're also showing the most common adverse events and lab values as a function of time. Right now, they usually have the ability of exploring and visualizing this charts as a function of subgroup or subpopulations. But what we're aiming for in the immediate future is to have a tool that is more targeted to specific patients, so doctors can take decisions targeted to individuals. In addition to the efforts in developing a prototype, this summer we hosted a discussion group where we invited a set of 6 experts from different parts of the United States to talk about treatment selection in multiple myeloma and understand what are some of the threats, strengths, weaknesses, and opportunities in the area, and also with respect to our tool that we are developing. Results from this discussion group showcase that even showing just information about progression-free survival could be useful, because right now there's not a lot of technologies that can help you take a decision at the time of selecting a treatment using a data-driven approach. In addition to that, they stated that one of the main concerns or limitation that we currently have is with respect to the data. So the COMPASS data set is not from a randomized controlled trial, so that this makes causal inference a difficult task. But this situation can lead to opportunities like developing a new data set, trying to answer some specific type of questions. Right now, we're using the feedback that the doctors provided, the expert provided, and we're trying to move forward to enhancing our tool. To close, one can say that we can confirm statement from the literature that claim that multiple myeloma treatment selection relies mostly on clinical acumen, and therefore a data-driven decision support tool could be helpful for this situation and could enable us to have a clinical contribution in practice. A functional prototype was built, and future efforts will be directed to enhance the current prototype and design a set of experiments to test the effect of the tool on progression-free survival and adverse events. Thank you for your attention.